India has seen a big surge in non-communicable diseases, lifestyle-related ailments. And what proof of it is required when the ICMR comes out and says that there's been a 150% increase in diabetes patients in India. India is home to the world's second largest population having adult diabetes. Every sixth person in the world with diabetes is an Indian. The past 3 decades has witnessed a 150% increase in the number of people with diabetes in the country, says the Indian Council of Medical Research. The ICMR has now issued new guidelines on how to handle type 1 diabetes. The ICMR says that it is a matter of immense concern that progressive lowering of the age at which type 2 diabetes is being diagnosed, with the disease prevalence becoming apparent in the age group of 25 to 34 years in both rural and urban areas. Type 1 diabetes is an autoimmune disease characterized by insulin deficiency and hyperglycemia in people with underlying genetic susceptibility. It develops in children and teens as the pancreas either stops making insulin or makes it in very low amount.
So insulin is like oxygen for a diabetic type 1 diabetic patient. So it's really important that we give insulin as soon as diagnosis, because insulin is the only treatment for type 1 diabetic patient.
The ICMR guidelines particularly focus on lifestyle management, given that diabetes is a lifestyle disease. It talks about diet and it also talks about physical activity, which is integral and extremely important to keep this disease at bay.
If you see, exercise is also strongly recommended, because diet and exercise contribute almost 50% of diabetes management. So exercise is something we all need to recommend for every type 1 diabetic patient.
The ICMR says that the focus should be on lifestyle management, essentially diet and physical activity. The ICMR says that focus has to be on maintaining your blood pressure, your lipid levels. Also, the focus should be on your weight management. The ICMR says that one has to ensure adequate nutrition to facilitate healthy growth and development in children and address individual nutrition needs, incorporating personal, social and cultural preferences. The problem in India is that our diet is extremely rich in carbohydrates. The intake of complex carbohydrates should be encouraged to constitute at least 70% of the total carbs, is what the guidelines say. Regular physical activity increases the feeling of general well-being and helps prevent obesity and mitigates increased cardiovascular risk. The ICMR also says that insulin use becomes a lifelong issue and hence it must be regulated in the right way. The ICMR has also identified some side effects related to insulin use. This could be weight gain and infection. The ICMR says that type 1 diabetes patients should be monitoring their blood glucose prior to meals and snacks, at bedtime, prior to exercise, and when they suspect low plasma glucose, and also after treating low plasma glucose, and before starting any critical task such as driving. The ICMR says that diabetes in India has traversed from the high income to the middle income and then to the underprivileged section of the society. So nobody is untouched, is what the Indian Council of Medical Research says.
For more informative videos like this, keep watching India Today Newsmo.